if someone's in a crowded living condition, that they have a safe option, a voluntary safe option to make sure they can isolate away from their family, to limit household spread. And there are a lot of people who simply can't afford a 14-day hotel stay. I hope that the government is looking at these measures. I know they've been communicated clearly and loudly to the Premier and to the Prime Minister. And in these final few months, because we know the vaccination for many is not going to come until significantly into 2021, that these tools become readily available. On a good news front, the winter activities that I announced previously, the COVID-safe winter activities, are about to launch. And we understand that staying active and healthy is important, not just physically, but for your mental health. And it's why we launched a slew of new winter activities this year to make it easier for people to stay fit and active. So starting tomorrow, our residents will be able to enjoy 4 of our outdoor rinks at Gage Park, Mount Pleasant, Shinkuzi Park, and Gore Meadows. Our recreation and park staff have been working around the clock to ensure the safe opening of these rinks. I encourage you to lace up your skates and enjoy our beautiful Canadian winter outside. We also have a number of planned outdoor activities. On December 17th and January 5th, adults ages 55 and over are invited to virtual workshops in ceramics and 3D model kits and a paint night. These activities will be online for Brampton seniors. And then beginning on December 19th, children ages 6 to 10 can enjoy virtual holiday camps and workshops that offer safe, festive fun from the comfort of their home. For all details on the online workshops and the new winter amenities, you can go to brampton.ca. This morning, I also have a brief update from bylaw. Over the last week, our bylaw officers have laid 4 charges under the mandatory face coverings bylaw. That's down from previous weeks. There was also 7 charges for failing to comply with an order under the Reopening of Ontario Act. So once again, we are seeing a high level of compliance compared to what it was in June or July, and I want to thank bylaw for their ongoing dedication to the city. And I would note, with the holidays upon us, it's not the time for Christmas parties, it's not the time for New Year's parties. Be warned that bylaw has additional staff that are planned for the Christmas season and the New Year season, because we can't afford Christmas or a New Year spike, and we will take gatherings seriously. We just can't risk this spread when we're so close to the finish line. From an Osler perspective, I want to thank the tireless healthcare workers at the William Osler Healthcare System. Currently, there are 80 COVID-19 patients at Osler hospitals, 49 are at Brampton Civic, and 12 of those patients are receiving care in the ICU. Osler has reached a new milestone in testing. They've recently passed 307,905 COVID-19 tests. This is the most testing, and I'll repeat, this is the most testing of any hospital in the province of Ontario. So to Dr. Naveed Mohammed and his team, congratulations for what is clearly an incredible effort. With winter quickly approaching, Osler's testing center is moving indoors. So the testing locations are changing. Today, the drive-through testing center at South Fletcher's will close at 7 p.m. and will reopen indoors at Peel Memorial Centre for Integrated Health and Wellness tomorrow. Thursday, December 10th, testing hours will be 8 a.m. to 7 p.m. daily. So it will no longer be at South Fletcher's. Moving testing indoors will ensure the health and safety and comfort of patients and testing center staff, as well as ensure the continuity of our COVID-19 testing efforts over the winter months. Osler's COVID-19 cold and flu clinic at Peel Memorial also remains open. They'll be on different locations in the property. So if you want to receive a test, there are still many options to do so in Brampton. And I want to thank Dr. Mohammed and his team for adapting to what was unexpected winter conditions. It is Canada after all, so we knew we would only be outdoors for so long. On that note, I want to welcome to the podium Dr. Lawrence Lowe.
Good morning, Brampton. Thank you, Mr. Mayor. Thank you, Council, for your continued leadership. As of this morning, Peel Public Health has investigated 19,296 cases of COVID-19 in the city of Brampton. Of these, 1,756 are active, 17,427 have recovered, and 113 have died. In Brampton, our test positivity has come down to 13% from a high of 15%, and our current rate per 100,000 is at 300 per 100,000, holding steady. I'm deeply concerned about the continuing and increasing hospitalizations and severity that we are seeing in our community. And while our precautions held this off for some time, we are now sadly seeing COVID-19 outbreaks return to long-term care settings in our community. And while there's excitement about a viable vaccine, I'm equally concerned about the growing apathy and anger towards the measures designed to bring COVID-19 back under control. It seems that while avoiding a worst-case scenario has spared many from the trauma of COVID-19, we're forgetting that others in the community have and continue to see the worst of this virus. We have members of our community losing their loved ones and family, treating neighbors and co-workers that are fighting for their lives, and we're not always hearing those stories. So picture this. Imagine COVID-19 is a hurricane, one that doesn't last the typical few days that a hurricane does, but nearly 10 months with no end in sight. Besides essential stores staying open to provide the necessities, everyone is heading for safety. In this case, staying home. No one is seriously throwing a party or opening their restaurants as the winds bear down. The storm surge is swamping the vulnerable areas in our community, overwhelming our elderly and our healthcare frontliners and essential workers. We're rushing in supplies and resources as quickly as we can to help them withstand the storm, but we are fighting against disparities that continue to render them at risk. And now what have I told you? That our collective actions determine how bad that storm surge gets. I know the lockdown measures are hard. They're not what we wanted, and that the closures are impacting so many. But as though we were in a hurricane, I want you to know that, as though we're in a hurricane, I want you to know that I fully support everyone impacted by the measures getting the help that they need. But you have to also remember that by stopping the storm surge, you're saving lives. And really, it isn't the measures that are the problem. It's the hurricane. It's COVID-19. However, it seems that of late, a lot of discussion has really focused on throwing doors open to the wind again as the storm surge continues to grow. And we forget those that are vocal in opposition to measures are the ones who have the health and ability to do so. So when you're asked to close and reduce your contacts, please know that this is not about punishment or being punitive. It's a call to a higher cause, to protect our most vulnerable. It's a reminder that with a disease that spreads from person to person, we're all ultimately connected, and that no one is safe from COVID unless we all are. So again, if you are able, you need to reduce your contacts. Limit close contact to your home and essential supports, through the holidays especially, and meet with precaution outside the home only for essential reasons. And when you can do your part to stop the spread, you're not only protecting yourself, but also those who cannot reduce their contacts by virtue of their circumstances. And by the way, it's time to stop blaming others, or even whole communities, for these continued challenges. There's been enough stigma and discrimination in this pandemic. We need to point the finger at our common enemy, which remains COVID-19. And to some extent, we should probably remember that these aren't ordinary times. Why should we expect that it be business as usual when the consequence in so many other communities around the world? We must hold the line until that vaccine becomes widely available, and that's still for some months yet. But until then, perhaps let's take some time this holiday season to reflect on the need to care for those less fortunate than ourselves. That is fundamental to so many faiths, so many cultures, and we need, through these last few months, to lift each other up during these uncertain times. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, for highlighting the bigger picture and our responsibilities in the fight against COVID-19. Our first question is from Graham Frisk from the Brampton Guardian.
Good morning, Mr. Mayor. How's it going?
Good.
I guess my first question would be for you, sir. Just curious, you mentioned that the city is hiring some new bylaw officers. I'm just curious, how many new bylaw officers and for the Christmas break, and Are they going to be permanent? Are they going to be just seasonal, or what's going on with that?
So I'm going to have Paul Morrison, who's our Director of Bylaw Enforcement, speak to that. Earlier in the year, we hired new bylaw officers to help us with the pandemic, but I believe these are just, it's overtime, it's additional shifts that are put on to handle the Christmas season.
Thank you, Graham, for the question. We actually have two prongs that we're going to deal with here. One is we are going to hire more officers, or actually we have hired more officers. They're in training right now. They should be ready to deploy in the next couple of weeks. There's a total of 4 of them. And then we're also going to supplement that with increasing our overtime, where we traditionally go down to a minimum staffing over the holidays. We've changed that. We're significantly going to up those numbers so that we have the holiday seasons covered off.
My follow-up, I guess, is for Dr. Lowe. Dr. Lowe, I'm noticing, I guess, as the numbers over the last few weeks have are sort of flattening out. We're about halfway through this 28-day lockdown. I'm just wondering what you foresee. Do you foresee an extension, or do you think we might be, I guess, opening up a little bit before the holidays?
Thanks so much, Graham, for the question. At this time, we're continuing to follow the data very closely. We have to remember, of course, that this disease moves in 2-week increments, so we've only gotten 1 incubation period in with the gray lockdown. Certainly, we are starting to see our case rise slow, but we do know that numbers are still going in the wrong direction. They're still rising, just not as quickly as they were before. Hopefully, reaching a bit of a plateau. But again, we need a little bit more time just to sort of figure things out and make sure that things are trending in the right way. Either way, I think the advice is going to be the same for the holiday season, and you've heard it from the Premier loud and clear. To the extent possible, you want to make sure that you are limiting your close contacts and celebrations to the people you already live with. And hopefully, if we do that right, if we keep numbers down, then when the vaccine arrives, it'll be easier for us to get back down to ground. And then hopefully this will be the only COVID Christmas we have to deal with. Thanks for the question, Greg.
Okay, our last question is from Nitin Chopra from Prime Asia TV.
Good morning, Mayor, and good morning to everyone. My question is for Paul Morrison, or Mayor can also answer that. Since Peel and Toronto is under lockdown, in the last days we have seen a lot of rallies in this scenario in pandemic, and doing a protest is a fundamental right. But some people, when we see large gathering of people in the parking plazas, or bylaws broken, or without mask, more gatherings, and also we reach to the police also in this regard, but no one has the answer. When we see people out of the windows, out of the sunroofs in large numbers, any tickets issued in this scenario by the bylaw or the police? Thank you.
So I want to say, first of all, that we certainly have a lot of sympathy for what is happening to farmers in India. And I believe the right to peaceful protest is fundamental, and I think it's why you've seen every federal political party come out and speak publicly in favor of the farmers' right to protest. Having said that, we have to be mindful of public health guidelines, and the right to protest is a fundamental right in Canada. And just like when we had the Black Lives Matters protest or the Nigerian End SARS protest, we were respectful of that fundamental constitutional right. But we do hope, as people protest, that they are mindful that they do not want to contribute to the spread of COVID-19. I know there could be some ongoing protest with this show of support for India's farmers, and I'm asking them to be extra careful. Even though they're allowed to, it doesn't mean that you should let your guard down in terms of not wearing a face mask or being within 6 feet. I don't believe any tickets were issued because it is a fundamental right, but Paul Morrison can speak to that as well. And maybe Dr. Lowe will want to offer some guidance for the next protest as well.
Thank you for the question. We didn't issue any tickets on that weekend that you're mentioning, but we did issue quite a few warnings, quite a few verbal warnings. The difficulty is the protest took place outside, which is hard to enforce in the sense that you can be outside without a mask on. We just ask that you social distance, and we ask that you put a mask on if you can't social distance. But being outside, once again, very difficult to enforce.
Yes, thank you, and just responding as per the mayor. Certainly, I ask everyone, and recognizing, of course, the fundamental right for people to express themselves and protest. We are at a time in the course of our measures where we are hoping to bring this under control in our community, and we're hoping to limit and control spread. So, to the extent that I really encourage people to perhaps consider the timing of any action or activity, and if it must go ahead, then to really stick to those. Like I said, the golden rule right now is close contact with the people you live with under the same roof, and then if you're meeting anyone for in person outside of that home, then making sure that you are sticking to every precaution of distancing, masking, and trying to keep numbers low as much as possible. And so, certainly it's a challenge, but my recommendation at this point in time, as with anything, is let's try to keep limit social gatherings, limit size of gatherings, limit the size of any gatherings, certainly with protests, recognizing, of course, the sensitivity of the situation. Thank you.
Thank you.
Okay, that completes our questions today. I want to thank everyone for tuning in. Stay safe, stay healthy, and until our next COVID-19 update, we will see you then, Brenton.
That is a wrap. Mayor Patrick Brown and Dr. Lowe, the Chief Medical Officer of Health for the region, and today's COVID-19 update. It's 9:21, and you're watching Toronto.